Well,
Morning,
thank you.
Bob.
It's good to be here, Bob. And as Bob said, I'm Joan Hogan, and I'm welcoming you to our Prairie Doc Radio program. Rick Holm, our Prairie Doc, is in the studio, ready to answer your questions of a medical nature. Dr. Holm's specialty is internal medicine. He's a physician with the Vera Medical Group Brookings. He's also a clinical professor at the University of South Dakota Sanford School of Medicine. And he is also in affiliation with South Dakota State University, where he's conducting his medical research called For Me.
For me.
Good to have you here, Dr. Holmes.
It's good
Couldn't
to
do a
be
show without you. And added to that, we have a guest today, and our guest is Jamie Halverson, who is just finishing or has finished a doctorate in OT, occupational therapy. Welcome to the program, Jamie.
Yeah, thank you for having me.
Oh, it's a joy. So tell us a little bit about now. You're working on your doctorate, or you finished your doctorate?
Yes,
Or-
I'm working on my doctorate. I started last fall with hopes to finish this December. I'm hoping to implement my program, a community-based program called Safe at Home in the Brookings community. Within the next 2 or 3 weeks, I'd like to start getting participants and kind of get the program going.
Well, you spoke to me yesterday, and I said, "Gee, we should have you on the show today."
Yeah.
Is that how it went?
Yeah.
But it sounds so good. I thought, well, gee, let's hear about it. And I didn't have time at
Right.
that moment to hear about it.
hmm
So, but you're from where?
I'm originally from Presho, South Dakota.
You're Presho.
Yeah, West River. Yeah, my husband and I are both from West River. He's from Kennebec. Grew up there. Went to school at the University of South Dakota. So I
Yes.
have a hard time kind of fitting in here in Brookings.
Well,
but
so have many of us.
Right,
And
yep.
USD people that really have become jackrabbits.
We kind of
Yep.
allow you in here. You know,
Yeah,
we're not
we are allowed.
proud or thrilled to have you here, but we put up with you.
So, Presho girl, and you did OT training in Vermilion.
Yep, yes,
And now you're here for how long? You've been up here?
My husband and I have been up here for about a year and a half. I was working at another company in another town close by, and I recently started actually at the hospital a couple weeks ago, and so kind of trying to get my feet wet and get to know everybody, and yeah, it's been a great experience so far.
And then your doctorate is through USD or
Yes,
through
yep.
SSU?
Yeah, so I got my master's I graduated in December of 2014, and the doctorate program started last fall, and it's a post-professional doctorate, and so I'm completing it all online. There's about, I think, 5 or 7 peers that are taking the program with me, and so 5 of us are hoping to graduate in December, and the other 2 next spring.
So, so explain first, before we take that first break, what occupational therapy is and compare it, please, to physical therapy.
Yeah, occupational therapy. So everything that we want and need to be able to do on a daily basis, they're called occupations. So whether that be very simple things like, dressing, bathing, showering, all the way up to tasks such as caregiving, making meals, driving, laundry, any of those things that you need to be able to do every day that are important to you. That's what we call occupation. That's really what my focus is on, is making sure that you're able to do those things that you want and need to be able to do.
Not necessarily occupation like medical doctor
Right,
or
right.
radio,
Right.
neuro, or anything like that.
Yeah, it's a common misconception. Occupation, people obviously think of work as the first thing that they think of, but really anything that we do in our day that fills up our time is considered occupation, and that's really what I try to help people do.
It
Well,
occupies your time.
Yes,
It goes me
exactly.
right into what activities of daily living are
Yes.
compared to occupation. Are they different, or would you define them differently?
I would say activities of daily living are occupations. Activities of daily living in occupational therapy scope of practice are, like I mentioned, dressing, bathing, grooming, using the bathroom.
Brushing your teeth.
Yep, brushing your teeth, yep. Any of those things that you are integrated into your normal daily routine that you need to be able to do to function. Yep.
Right.
Okay. Well, it's interesting. I know I have a sister who's a physical therapist, and she went through school in the late 60s. And at that time, it was pretty hard to convince people you weren't just a well-paid masseuse. it really wasn't a
Yeah.
respected field. And, over the past 40 years or 60 years, it's been highly respected. And I think occupational therapy may have gone through the same thing. What do they do? Teach me how to get in a car? Who cares? And it was
Right.
not respected. But I think in the past 30 years or so, have you found that the respect is there for your field of study?
Oh, definitely, especially for the, older adult population who, I can touch on this later, but they want to be able to live in their homes and they want to be able to function independently and stay at home for as long as they can.
So they really
it's-
respect your work.
Right,
Well,
yeah.
That's great.
They need, we all need your help.
Absolutely.
That being able to stay at home is a crucial issue.
It is very,
about
yep. mhm.
Quality of life.
Well, let's discuss this more after this break. We'll be back right after these words. Hi, welcome back to Prairie Doc Radio. We're happy to have you listening today. Dr. Rick Holm is here, ready to answer any questions you might have of a medical nature. If you have questions about occupational therapy, we have a professional in the studio with us. Jamie Halverson is a professional occupational therapist, and she's also just working on completing her doctorate in occupational therapy. And in doing this, she has a study that she is conducting. Is this correct?
Well, it's not actually a study per se. I would like to propose a program. It's a community-based educational program, and the title of it is called Safe at Home, and it's designed to prevent falls and enhance home safety for the older adult population. And really what the aims of the program are to keep older adults in their homes for as long as they're able to, provide them with the tools and the knowledge and the resources to help them engage in those occupations that they really care about, and that are important to being able to stay in their homes for as long as they can.
One of the things that I see occupational therapy consults in the hospital evolve to is, okay, we are getting ready now after your hip fracture and your physical therapy and your recovery to go home. But
Yes.
is it safe to go home?
That is exactly right.
And so we have consulted, and through the years, it's evolved, and my knowledge has evolved, and I think OT has evolved to be the
Yeah.
group that says, okay, we'll do a home safety home safety eval. And so we make that consultation, and the day before they go home, a home safety eval is done, and the patient is prepared to go home, and they go through a walkthrough. Well, explain to what a home safety eval is.
So once we get that referral from the doctor, we, talk with the patient about, okay, this is what we're going to do. We're just going to take you throughout your home and kind of see how the setup is, if there's anything, any modifications that need to be made. For instance, fall hazards are a big thing because we obviously don't want anyone to fall when they go home. So
Cords on the floor,
yep.
slippery rugs,
Yep. Yep.
no handrails where they need to be.
Right, exactly. Making sure their environment is optimal for them. Making sure that's set up in the appropriate way. Making sure that they can reach things. Like you mentioned, fall trip hazards like the rugs and the cords, and making sure that they can get up and down their steps, or and maybe if there's some things that we need to work on before they go home, we have that time to do that in the hospital, or if the patient is in swing bed, we have time to kind of work on those things and help them prepare a little bit better. Yeah.
So now your program that you're devising.
Yep.
Is what? Let's hear a little bit more about that.
So my program is going to be, I'm hoping to have it to be like a 6 to 8 week program where we talk about different topics every week regarding aging in place. So really,
Aging in place,
Yep.
in your home.
in your home, yes, in your home. So to start out with, I'd like to start out with introducing kind of what occupation is and kind of the basis of what occupational therapy is, kind of like what we've been talking about today. I'm also going to have each week different topics. And so some of the topics I'd like to talk about in my program are, the importance of nutrition and exercise, adaptive equipment and home modifications, to help you be able to perform those important occupations. Balance, exercise, and strengthening, stress reduction, and helping to reduce the fear of falling if an older adult has that. Also, energy conservation and medication management. Those are all things that fall into occupational therapy's scope of practice to help the older adult stay in their home as long as they can.
The one before medication management was what?
Energy conservation.
So explain that.
Yeah, energy conservation. So, some individuals have, kind of low energy, low endurance. So energy conservation is really, saving up your energy for those things that are important for you to do. So, segmenting tasks into little small manageable pieces, that you can do throughout your day instead of doing a whole task at one time and then, wearing yourself out. So that's kind of what energy conservation is all about.
Can you give an example of that?
So say, for instance, you have a patient with chronic obstructive pulmonary disease, so COPD. That's a pretty common, diagnosis among our older adults.
Unfortunately, too common people have severe lung disease, and it's related to smoking, and
Right.
they're unable to do a lot very long.
Right.
Run out of breath quickly.
Mm-hmm. So, for example, you have your laundry that you need to be able to do. So, separating the steps of being able to do laundry into, manageable tasks. So, first of all, you could take the laundry to the washer and dryer and set it down, and then, we might need to take a rest break. And then the next step might be to, put the laundry into the washer or dryer, and then you need to take another rest break. And just kind of going through those, steps of a task rather than doing the whole task at one time.
It's laundry day. I'm going to do the laundry no matter what. It's killing me, but I'm going to get it done. And that is not the way to do it.
Right, yeah. Manageable tasks, manageable little steps to help you get the job done.
So that's energy conservation. Wow. Now, in this program, are you hoping to get people to enroll in the what is your plan?
Yep. I'm hoping to have, this is going to be kind of a discussion group and kind of a focus group. And like I said, it's not research per se. It is more a community-based educational program. So I'm hoping to get, 5 to 10, I don't know how many people would be interested in something like this. But to kind of get them in this group weekly, I'm thinking about, between an hour and 2 hours one time a week for 6 to 8 weeks to kind of discuss the topics that we've been talking about today, and really give them the tools to be able to live at home safely and independently, because that's really what aging in place is all about. Being able to have an individual be safe and confident in their abilities to be at home for as long as they can.
So what would a program like this cost them?
Well, right now, since this is a pilot program, this is the very first implementation of this program. My intentions are for it to be free of cost for the 6 to 8 weeks, each hour. And then I would also like to incorporate, if that participant is able and willing, to have me in their homes to kind of see, how their environment is set up, and if there's anything that we need to change to make it easier for them to be able to live in their home. And we're kind of in the works with that within the hospital, trying to come up with just a small fee for that. But for the program, the educational program, I will be providing that, free of cost.
And how are you hoping to find the people to be in this program?
Well, getting the word out today with this radio show is great. There's also people in our own therapy department, that might benefit from this program. Also, I'd like to see if I could partner maybe with the senior center downtown, and kind of,
that'd be a good idea.
Yeah.
So if they were interested, they could just call the hospital and leave a message for Jamie.
Yes. Our phone number is 605-696-8821.
So that's your OT, 8821.
Yep, that's the therapy.
If you just went to hospital and said, I want to go to OT.
Yep, they would direct your call. Yep.
So here's what I think. very healthy people out there right now who plan to live forever in their house, this would be an appropriate thing to do well before the time that you need it.
Yes.
So many people who are listening, I'm fine, should realize that this might be an opportunity to stay fine.
That is exactly right.
So, it wouldn't hurt anybody to just go do this. And, the price may be a whole lot more later. Let's save the money, do this program that's almost for free, and dive into it. I would strongly recommend this for anybody.
Great idea. We're going to take our second break. We'll be back right after these words. Welcome back to Prairie Doc Radio. We're happy to have you listening today. We're learning quite a bit about occupational therapy because our guest today is Jamie Halverson, who is an occupational therapist. She's employed at the Brookings Hospital. That's not the right word. Brookings Health System.
Yep.
Brookings, but actually the hospital. But the Brookings Health System, and she is setting up a new program called Safe at Home and hoping to have people interested in that. I think they would be. When you were talking about going through a home and making changes, I have, because I really watched my mother over the years. She was 30 years older than me, and I'd see her run into problems. About 15 years ago, we gutted the 2 bathrooms in our house. We didn't want to move, and we knew they both, and my kids laughed so hard because I put in 2 guardrails in the
Yep,
bathtub.
grab rails.
Grab
Yep.
rails. What do you need those for? I said, I don't need them now, but I'm not
Yeah,
getting any younger.
That was very wise.
And I put those in. And last year I was down in Florida, visited my sister, and I said, well, where are the dishes? I'll set the table down there. And they were in a lower drawer. I said, nobody keeps their dishes down low. Why not? We just redid our kitchen. I now have drawers that are below because you have no idea when you get older to reach up above and put those dishes away. It's painful. It just is. You do get older. There's no 2 ways about it. If the bottom drawers in your kitchen are available and you shift the dishes, the things you use every day,
Right. Yep.
come out of the dishwasher or wash them yourself, go right in that lower drawer, what a difference that makes. And I'll bet those are just a couple of the examples that you can give people when you visit their
Right,
home.
exactly, yeah. Going off of that, I think they also make, cabinets that have the fold down shelves that they can actually, they're on springs and they can come down to your countertop height.
My friend Mari Larson, has been in a wheelchair her entire life. She has spinal bifida. So when she moved into her home, she put all those cabinets in. So even though she's in a wheelchair, she can reach everything in her kitchen
Right.
because the
With these
cabinets,
fold-down
they
cabinets.
come down. They're
Yeah.
just phenomenal. There's nothing in the kitchen she cannot reach. So there are many ways of making a home accessible without
Right.
spending a lot of money. Like even those drawers. Anyone could take drawers that maybe they put pots and pans in down below and move your dishes there. You know, there's just ways of doing it.
So what would be the biggest error that people do? My sense is, I can just see that slippery carpet in our hallway that we used to have. I also think about the railings that we don't have in certain spots. I think about the clutter.
Yes,
and then
clutter.
The next thought I have is the hoarders that we have in the world.
Oh,
And of course, we all groan because I'm a little bit of a hoarder myself, and so my piles of New England journals I need to throw out, and I've got my
Just
I'm
haven't
hoarding
gotten
right
around to
now
it.
The recycling bin right next to my New England journals, and so I'm working on it, but I've got to do better. Any other comments? I made those points. Do you agree with those?
I definitely agree with those. Another big thing is lighting. As we age, our eyes, start to fail. And so the more light that we can have in our environments, the more that we're able to see what we're doing. Another big thing is contrast. You don't think about if something is colored, you might not be able to tell the difference between, red or orange or something. But if you have contrast there, white on black or black on white, that helps too. But really, another thing that's been proven in the literature is lighting. Making sure you have enough task lighting to be able to do what you're doing. That's another huge thing for older people.
And that requires a certain amount of electrician help, because many people just did not put the lights in. They're not there. The adequate lighting is not a real deal in many people's homes.
Right, yeah, sometimes, if there's major changes that need to be made, sometimes enlisting the help of a, licensed contractor is a good idea. There's certified aging in place specialists. That's a designation that some, home builders have, or, I'm even trying to think of, people in the community that would be able to provide these services, and I think I'm going to try and get the CAP certification at some point, just because that's, like I said, aging in place is going to be so much more commonplace, and to have that knowledge.
Are you suggesting that the boomers are getting older? Is that what you're saying?
Well, that is the trend. That is the trend.
Well,
Yeah.
and so, I mean, the thing I immediately think of is, okay, I can put a lamp over here, a lamp over here, a lamp over here. I have more lighting, and I'll also have cords all over the floor on which to trip. So, I mean, I think there is part of the rub. We need to, when people have old homes, they don't have plug-ins.
Right.
So they stretch cords all over the place, and then zimp, bang, wham, they break a hip, they're in the nursing home, they never go back to that home. So, you have to have some help there.
Mm-hmm. Yep, knowledge of, people who know what they're doing and, have been through these situations before and have experience in what works and what doesn't work, so that's very important. Yep.
And a lot of times you're fearful of spending that much money on electricity. I got an electrician in, he's going to add this wiring, it's going to cost so much. It sure is cheaper than a broken hip.
That is exactly right.
Just,
Broken
you
hip
have
is a little bit more spendy. Yes,
sometimes, and you can be surprised too. You can bring someone in and just say, I want this done, add this so I don't have strings all over the house. Just give me a cost estimate. It might surprise you. It'd be lesser than you'd think.
So here's another thing that you said. You said exercise and nutrition. Of course, that's my program for me. We're doing right now. One of the things that I learned yesterday, a particular couple who said that they were having this pork chop and something meal that they have mailed to them. And they have, and I don't remember the name of the thing to give you any of the news of it right now, but I'll learn it over time because I know we're going to talk about it. You can order a meal for two. You'll eat it, or you may have leftovers. So that's two. You can order 3 a week, and they're remarkably not that expensive. They come in not from South Dakota, not from Brookings, but they're mailed in, and
yeah, I think I've heard of that.
And they're decent meals, and they're variety, and they're balanced, and they're nutritious, and they're not high calorie. So I mean, the point I'm making is that those of us who all we know how to do is a cheese sandwich, and an egg, and we're all alone, and we're not about to go to this the elderly eating place, but I can't remember.
60s plus.
60s plus.
To go eat there, because I just don't
They
want to
may
go
not
that.
be eating healthy. Right.
They may not be eating healthy, and I think about the nutrition that we need. We need enough proper balanced protein.
Yep, and colorful fruits and vegetables. Yep.
Yeah, colorful fruits and vegetables. So let's talk about nutrition just a little bit.
Well, as we age, our bodies tend to metabolize things a little bit differently, and so as we age, we also need to be able to have, like you're saying, Dr. Holm, a balanced diet. Lean meats, colorful fruits and vegetables, and really having balanced meals a day instead of, sometimes we tend to snack too. So really having those meals a day are very important in, keeping our strength up, and being able to do those meaningful occupations that we want and need to be able to do every day. Another thing in my program, I'd like to incorporate maybe nutrition logs, so that maybe people will get a better idea, starting to track a trend of their eating habits and how to improve that.
A lot of interesting things going on here. We appreciate Jamie's visiting us today. We're going to take our final break, and we'll be back right after these words.
We're back.
Hi, welcome back to Prairie Doc Radio. Rick Holm and I are here visiting with Jamie Halverson, an occupational therapist, and we have learned a lot today. This has been fun.
It's a
I've
good
really
deal,
enjoyed it.
And it's great to see you in Brookings and add to our community health team, because that's what it is. It's a teamwork deal.
Yes.
PT, the doctors, the nursing staff, the PAs.
Once again, Jamie is just starting a program called Safe at Home, and if you're interested in it, you can give her a call at 696-8821. That will connect you with the occupational therapy department at the Brookings Health System,
Yep.
or just call the Brookings Health System if you forget.
And then they can connect
I want
you with
occupational
OT.
therapy. Say you heard Jamie Halverson on the radio today, and you would like to know more about this program, and she will get back to you.
Yeah.
Thank you.
Really helpful,
Yeah.
Jamie. Say tomorrow night you've got another new program.
Yes,
You're
we do.
really in the role
We're
now.
on the roll.
Right.
We have Tony Herricks, who is a pulmonologist, a lung specialist. And I've struggled with my essay this week. I wrote, it's called The Smoking Gun. Of course,
Oh,
it talks
I love the
about-
way you name some of these. That's good. The smoking gun.
And it was, the whole issue is that many people in our town and community and state and nation have lung disease. Some have been smoking, some are not. And there are issues about lungs that are very important. And in the end of our lives, at that final quarter of the life, right, the last, the fourth season, we have less lung buffer, and so we are at risk of problems with the lung. And if you look at things that can come down and get us in the end, it is that we don't have as much lung available, and we're more at risk for infections, and bad infections can indeed occur in the lung. That's probably our most susceptible Achilles heel, as they would say, in the body, because everything the air has to pass there to exchange. It's a real contact with the environment. That's the lung. The skin and the lungs are the big contact.
So we'll learn a lot about that tomorrow, right?
So we'll learn about it
Okay,
tomorrow, Tony
very good.
Herricks.
South Dakota Public Television, 7 o'clock Thursday night. One other thing, Dr. Holm, what about this extra strength flu vaccine? We've heard about it. Why wouldn't you just get the normal flu vaccine? And should we be thinking about getting that flu vaccine now?
And the answer is yes. You asked me maybe a couple, 3-4 weeks. I said, wait until you start seeing it occurring. No, the word is, let's get the flu vaccine now. The answer on the extra strength is 4 times stronger. So there's a significant higher risk of it causing a reaction of any kind. It's a significant higher risk of it giving you a significant immune system reaction to it. If you're elderly in particular, it may be that it will help you. The studies early say 20% less pneumonia in the group getting the extra strength versus the regular strength. And they're saying 65 or 70 or 75 and older get the extra strength. The answer is it's not perfectly proven yet, and I haven't jumped on the bandwagon yet, but that's the thinking, so stay tuned.
Okay, thanks so much. We do hope you've all enjoyed our Prairie Doc radio program, and we'll listen again for Prairie Doc, brought to you by the Avera Medical Group Brookings. As always, you can hear and see more from Dr. Holm online at prairiedoc.org. Thanks so much, Jamie, for joining us today.
Yeah, thank you for having me.
And thank you, Dr. Holm.
Thank you, Joan. Thank you, Jamie, Bob, and stay healthy out there, people.